good morning.
Hi, good morning.
I am Josephine Vuchansu. I'm a nurse practitioner and I will be your health provider today. So tell me, what brings you to the clinic today?
I'm just here for a general wellness assessment.
I'll be more than happy to help you with that. So, how do you know about this clinic? Who referred you here?
I've been going here regularly already.
Okay, great.
Yeah.
Where do you live?
I live in Frederick, Maryland.
Okay. So for your wellness exam today, I will be doing complete head to toe physical assessment, and this would include me asking you questions, and also I'm gonna be looking at your body, sometimes touching you, and in the course of my exam, if you feel any discomfort or pain, please don't hesitate to tell me, okay? I'll also ask you some questions to get your history and just answer to the best of your ability, okay?
Okay.
So, do you have any medical problems at all?
No.
Do you have any complaints today?
No.
You don't have any pain in your body or anything you want us to talk about today?
No, not specifically.
You just want to do your wellness exam.
Yes.
Okay, great. Do you have any allergies?
No.
Are you allergic to latex?
No.
Are you allergic to iodine?
No.
Are you allergic to do you have any environmental allergies?
No.
How about any food allergies?
No.
Okay, great. Do you as a child did you have any illnesses?
No.
How about in your adulthood? Do you have any illnesses?
No one in my family.
Okay. How about have you ever been pregnant before?
No.
When was your last menstrual period?
The 26th of this month.
Okay, good. Do you have any psychiatry history?
No.
Okay. Do you have any depression or anxiety?
No.
Have you ever been hospitalized in a mental health hospital?
Mm-mm.
Okay. Have you ever been hospitalized at all?
No.
Okay, great. Oh, you've been very healthy. I like that.
Thank you.
So do you have what's your family medical history? Like your mom, what does your mom have? Is your mom still living?
Yes, her mom is still alive and she's healthy.
How old is she?
She's 49.
Good. How about your dad? Is he living?
Yes, he's living. And he's healthy and he is 50.
Great. How about your maternal grandmother? Is she alive?
Yes, she's alive and well.
Is she healthy or she has any medical problems?
No, she's healthy.
Maternal grandfather?
He's healthy.
How old is he?
I'm not sure. I think he's in his 70s.
Okay, great. How about your paternal grandfather?
He's he's deceased.
Okay, do you know what he died of?
Old age.
Okay, great. How about your paternal grandmother?
She's alive and she's healthy. I'm not sure how old she is though.
Okay, you seem to have a very healthy family, and you know, healthy genes is genetic, so you have a great chance of staying healthy because you seem to have a very good, strong family, healthy history. Now I'm going to ask you about your surgical history. Have you had any surgeries in the past?
No.
No surgeries?
No.
Okay, great. Have you, so tell me a little bit about yourself. Like, are you a student? Do you go to school?
Yeah, I'm a college freshman and I go to school at University of Virginia, UVA.
Okay, great. So, oh, awesome. Congratulations.
Thank you.
What do you do for fun?
I like to hang out with my friends or like watch TV, but given the circumstances of the pandemic, I normally just stay inside now.
Okay. How about Your religious affiliation, do you have any religious affiliation?
Yes, I'm a Christian.
You go to church?
Yes.
Okay, interesting. You talk about your friends, so you do have friends. You have support system. How about your family? You have a good relationship with your family? Do you live by yourself or you live with family?
No, I live with family.
Okay, who do you live with?
I live with my mom and my aunt and my cousins.
Okay. Do you smoke cigarettes?
No.
Do you drink alcohol?
No.
Have you ever used any illicit drugs like street drugs, marijuana, cocaine, all that?
No.
Do you drink coffee?
No.
Okay. Wow. Yeah, that's good. That's nice. Keep it up. Okay. Do you do any kind of physical exercise?
Yes. From time to time, yeah. I try to do some at least twice a week.
What kind of exercise do you do?
I go and run sometimes, or just like playing outside, walking outside.
Okay, that's good. Keep it up, because staying active is part of staying healthy, and that is a good contribution to your health. Do you drink a lot of water or you drink a lot of sodas?
I drink a lot of water. I don't drink soda at all.
That's good. That's good. I have to learn that from you. How about your diet? What kind of food do you normally eat?
I try to eat veggies, but normally I try to stay balanced, but I have a lot of like carbs sometimes, but I try to have a vegetable with every meal.
Okay, that's good. That's good. And eating healthy involves keeping a balanced meal, just like you said. Eat a lot of vegetables, less carbs, and more proteins. That's a good way to keep yourself healthy. Now I'm just gonna do a quick review of system, and you just tell me if you have experienced any of these things. Okay? Have you had any head traumas recently?
No.
Any headaches?
No.
Have you been feeling dizzy?
No.
Do you have any blurry vision?
No.
Any pains in your eyes?
No.
Have you been congested?
No.
Any runny nose? Any pain on your sinuses?
No.
Do you have any sore throat?
No.
Any coughing?
No.
Sneezing? And any chills? Any fever? Any pain in your ears? Any discharge in your ears? Do you have any pain on your neck?
No.
Any problem with range of motion on your neck? Are you able to move all your joints? Any joint pains?
No joint pain.
Any chest pain? Any palpitations lately? Do you have shortness of breath? Any dyspnea, like on exertion, like when you move or you walk, do you feel short of breath? Do you have any abdominal pain? Any constipation? Have you had any diarrhea?
No.
Do you have have you been nauseous lately?
No.
Any vomiting? Any problems with urination?
No.
Do you have painful urination?
No.
Any discharge? Any vaginal discharge? Any vaginal discharge?
No.
Any itching? Any vaginal itching?
No.
Okay. Any knee pain?
No.
Ankle pain? Any swelling on your feet?
No.
Any clubbing on your nails?
No.
Okay, great. So now I'm gonna proceed to do that's the history part of it. So now I'm going to do the physical examination, and I'll start with your head. Okay? So I will just looking at you, I see that you are well nourished. Oh, I didn't ask you. Have you had any changes in your weight lately? You're well nourished. I see your skin is moist, no dryness. Your hands, no clubbing on your nails. Nails are even. your hair is evenly distributed, and your skin color is appropriate. Now I'm going to palpate your head, and you tell me if you have any tender areas. And I didn't get any palpation, and I see your hair is also evenly distributed. Now I'm going to proceed to check your okay, let me do cranial nerve 1. So I'm gonna have you close your eyes for me, and I will put something to at your nose to smell, and you tell me what smell it is, okay? What do you smell?
Alcohol.
Okay, so that is cranial nerve 1, which is appropriate. Now I'm gonna have you look at me, smile for me, close your eyes tight. Okay, now raise your eyes up. Look, open your eyes, raise them up and down. Okay, and that is cranial nerve 7, which is normal. Now can you take off your glasses for me? Do you wear corrective glasses?
No.
Okay, so I'm going to start with your eyes. I'm just looking at your eyes. I see your eyelids are normal on both sides. I don't see any drainage or any swelling. I'm going to use this. I'm going to check for cranial nerve 2 using this Snell's chart. I'm going to have you cover one of your eyes, and you're going to read this line for me. Cover one of your eye and read the last line.
LTFPH.
Good. Now do repeat it with the other eye.
LTFPH.
Okay, great. Now open both eyes and read it again.
LTFPH.
Perfect. That's cranial nerve 2, which is normal. Now I'm going to check for cranial nerve 3, 4, and 6, which is extraocular movement. So I'm going to have you look straight at me, and do not move your head, but just follow my hands, my hand with your eye, just your eyes, okay? So first of all, stare stare far up on the wall. Look at my hand. Now follow my eye movement, just with your eyes and not with your head, okay? Okay, perfect. So that is the extraocular eye movement, which is perfect. Now I'm going to check for your pupil response to light. So I'm going to shine this light to your eyes, and I'm going to see the response of both eyes. So just look straight at the pen. So the right pupil, it's contracting with the light, and there is a consensual reaction because the other one is contracting too. So the left pupil is contracting too, and there's consensual reaction because both of them are contracting. Now I'm going to check for convergence. So I'm going to bring this light towards your nose and follow the movement of the pen, okay? Just follow the movement of the pen to your nose. Okay, so there's convergence. So your eyes your pupils are equal reactive to light, round, and they converge and they accommodate. That's parallel. Now I'm going to get my ophthalmoscope and check your pupils. Where's the head? part. Yeah.
Are you sure? I think we're missing something.
Okay, so okay, now I'm going to check your pupils. First, I will start with checking the red light reflex. Okay, so I'm checking for the red light reflex, and I see the red light reflex is present, and I would go closer, like the fundus of your eye, and I see the fundus has sharp margins, and the red light reflex is still there. For the purpose of the video, I'm only going to do it on one side, okay? Okay, now I'm going to proceed to your nose. Just looking at your nose. So I'll have you cover one of your nose and just exhale to check for patency. Okay, and I can feel the air blowing, so your nose, that nostril is patent. Do it with the other nose. The other nostril. Okay, there's patency in both nostrils. Now I see the septum is midline, and I will have you lift your head a little bit, and I will check your nostrils for, I'll check your turbinates, okay? So I see your turbinates. They are pink, no inflammation, no drainage, and they are patent. Now do the same on the other side. Okay, turbinates are pink, no inflammation, and no drainage. Okay. So I already checked for cranial nerve 1 on the nose. Now I'm going to proceed to your mouth. I'm gonna looking at your lips. There's no lesions or any bruising or anything. I'm gonna have you open your mouth for me, and I'll just look in your mouth. I don't see no sores. I see your uvula moving. I would have you, for the purpose of the test, I'm not going to check for the gait reflex, but I would go ahead and check for cranial nerve 12. So stick your tongue out for me. Like rock your tongue all around your mouth, up and down in a circular motion. Okay, so your tongue is moving, so cranial nerve 12 is intact. Now I'm going to proceed to your ears. I'm just going to inspect your ears, your pinna. They look, no inflammation, no rashing, no lesions. I'm going to palpate your look at your mastoid. I don't see no swelling on it, no redness. I'm going to palpate your mastoid. Any pain? Okay,
No.
good. Now I'm going to use my otoscope to check to look at your external ear. Pull it up and out. So the external ear canal is pink, no inflammation. The TMJ is intact and pearly gray, and the light reflex is in place. The purpose of the test, I'm not gonna repeat it on the other side. Okay. Now I'm gonna check for hearing, and I'm gonna do the Ryan and Weber's test. In this test, I'm gonna tune this fork and I'm gonna put it on the back of your ear. When you stop hearing the sound, you let me know. I'm gonna bring it to the front of your ear, and then when you stop hearing the sound, you let me know, okay?
I can't hear anymore.
Okay. Are you hearing the sound?
I can't hear anymore.
Okay, good. So air conduction should be longer than bone conduction, so it was normal for you. Now that was the Ryan's test. Now I'm going to do the Weber's test, and for the Weber's test, I'm going to tune the fork. I'm going to put it on your forehead, and you're going to tell me if you're hearing the sound more on the right side or the left side or in the middle, okay?
I hear it more on my right side.
Okay, so for the normal test, it should be in the middle, which means that your hearing is equal on both sides. So well, we're gonna look more into that, okay? Now I'm gonna proceed to your neck. Just looking at your neck, I see the your thyroid is midline. I'm gonna palpate your thyroid to feel for any swelling lesions or anything, and I don't feel any. Do you feel any pain when I was palpating?
No.
Okay. I see I don't see no lesions or anything. Now I'm gonna go ahead and palpate the carotid artery, and it's right there. I'm gonna also listen for bruit on the carotid artery. And there's no bruit. And for the purpose of the test, we're not gonna repeat it on the other side. Now I'm gonna measure your PVC. I'm gonna use this. So for this one, I'm gonna have you lay down for me. Lean your head back. Okay. Now I'm gonna have you turn and look at the other side. So I'm looking for the external jugular vein. I see the pulsating of the internal jugular vein right there and the external jugular vein right here. So I'm gonna go ahead and measure it from your sternum. So your sternum is right here. I'm gonna put my tip, and I see the pulsation. Raise your head up a little bit more. Sit up a little bit for me. Sit. Okay, now lean again. Okay, now that's better. Okay, I'm gonna measure it in your sternum. And that is 1.5 centimeters, so which is normal, because the normal jugular vein pressure should be less than 3 centimeters. Okay, so I'm gonna proceed to the chest, and for this one, can you sit outward a little bit for me? So I'm just looking at your chest. I'll look at the anterior posterior diameter, and it looks normal. I don't see no barrel chest or anything. I'm gonna check for symmetry. For the sake of the exam, we're not gonna take off your clothes, so your chest is symmetrical. I don't see no labored breathing or anything like that. I'm gonna go ahead and listen to your lungs, and I'm just gonna show the positions where the lung sounds are supposed to be. And I'm gonna listen on the back as well. It's gonna be here. Okay. Now I'm gonna palpate for tactile firmness. When I place my hand on your chest, say 99, okay?
99. 99. 99.
Okay. No, yes. Stand up for me. Stand up. Okay.
99. 99. 99.
Okay. While I'm at your back, I'm gonna go ahead and measure chest expansion. So I'm gonna place both of my thumbs on your back and have you take a deep breath and watch for your chest expansion. Okay. Take a deep breath for me. Okay, that's perfect. Now release. So I see I have equal symmetric thumb movement, which means that her chest is expanding symmetrically. Now I'm gonna check for your diaphragmatic excursion, which I will do that by I'm gonna percuss your chest and I'll measure your. So I'm gonna have you take a deep breath. Take a deep breath for me and hold it, and then when I tell you to release, you release and hold it. Okay? So take a deep breath. Okay. Okay, so I think the resonance stop right here. Now exhale and hold it. Okay, so I stop hearing resonance here. So your diaphragmatic excursion is about 3 centimeters, which is normal. Okay. So now I'm gonna have you while you're standing, I'm gonna go ahead and percuss your posterior lungs, and then I'll do that in the front when you sit down. So I'm just gonna percuss your lung fields, and I expect to get resonance. Okay, I get resonance in all areas, and I would do the same thing on the front. Okay, so that's that for your lungs. Now I'm gonna have you sit back down. I'm gonna check, do your cardiovascular assessment. I'm gonna listen to your heart sounds. With this one, can you lay back for me? So I would listen to the heart sounds with both sides of my stethoscope, both the diaphragm and the bell of my stethoscope. So I'm gonna start by listening to the aortic valve right here on the second intercostal space, the pulmonic valve, then I go down to the Erb's point right here, and then the tricuspid and the mitral valve. and that's a good one. I'm going to repeat the same thing with the bell of my stethoscope. And I'm going to have you turn a little bit to your left side, just a little bit, so I can palpate the point of maximal impulse. It should be right here. And I feel the pulsating right there, normal pulsation. Now I'm going to, you can lay back on your back. Now I'm going to palpate your peripheral pulses. I'll do both. Peripheral pulses. This is the radial pulse. I'll do the brachial pulses, and it's a 2+ and no bruit. And then I'm gonna go ahead and do the femoral pulses. It is as expected, 2+, no bruit. I'm gonna do the popliteal pulses right here. It's expected, 2+, no bruit. I'm gonna do the pedialis pulses right here, expected, no bruit. And I'm gonna do the Achilles pulses right here, expected, no bruit. Now I'm also gonna palpate the temporal pulses, expected, with no bruit. I did the cardiac pulse already. Okay, I'm gonna proceed to the abdominal exam. So for the abdominal exam, for the purpose of the video, we're not gonna open your shirt, but we're gonna start with inspection for symmetry, and lesions, bruising, striae, rashes, any distension or scars. And then I'm going to start by auscultating the abdominal sounds, and I'm just going to show the places where I'll auscultate. So this is the right lower quad, right upper quad, left upper quad, right left lower quad. And then I'm gonna use the bell of my stethoscope to auscultate the abdominal arteries. I'm gonna do the aorta, which is about right here. I'm gonna do the right renal, left renal. It is pulses are normal, no bruit. The right iliac, left iliac, normal pulses are no bruit. Right femoral and left femoral, expected 2+, no bruit. Now I'm going to percuss all 4 abdominal quadrants, and I expect to get tympani. I get tympani right there. Right upper quad tympani, left upper quad tympani, left lower quad tympani. And now I'm going to do light palpation on all 4 quadrants, and then I will do deep palpation next. So I'll warm my hands first before I do the light palpation, and tell me if you feel any discomfort, tenderness, or pain, okay? So any discomfort or pain? No. Okay. Now I'm gonna do a deep palpation on all 4 quadrants, and tell me if. And for the light palpation, I didn't feel any, no masses, no guarding, no tenderness. Any pain? No. Okay. Any pain? No. Okay, so I didn't feel any masses, no distension, nothing like that. Now I'm going to palpate your liver, and I'm gonna have you take a exhale for me. Okay. Now, so I can feel the liver border about 1 centimeter above the costal margins, and on this area I can feel the liver right there about 7 centimeters above the costal margins, and I didn't feel no masses or tenderness. Now I'm going to palpate the spleen. I'm going to palpate your spleen right around the 10th intercostal space, and it's not palpable. Okay, now I'm going to palpate your kidneys. Just lay like that for me. So your kidneys, the right kidney is not palpable. And I do the same thing. Left kidney is not palpable. I'm going to have you sit up, and I'll check for CVA tenderness. Turn around this way. Okay. So I'm going to check for CVA tenderness right around the 12th intercostal margin. I'm going to check for CVA, and tell me if you feel any pain when I do this, okay?
Okay.
Any pain?
No.
Okay. I'm going to do the same thing on this side. Any pain?
No.
Okay, that CVA tenderness is negative. Now I'm going to have you lay back down. And I'm going to check on your, I'm going to check for the sour sign. So I'm going to lift your leg up, and you tell me if you feel any pain, okay?
Okay.
So no pain, so sour sign was negative. I'm going to do the Murphy's sign, which is to check if you have any gallbladder problem. Now I'm going to have you exhale again. Exhale completely and hold it for me. Okay, so I go down on the costal margins right here, and then exhale. Okay, so the Murphy's sign is negative because she didn't have any pain on exhalation. Okay, now I'm going to check for I'm going to go ahead and check for the obturator sign. So I'm going to have you lift your leg up. I'm going to hold it up like that. That is the obturator sign. I'm going to rotate it inward and rotate it outward, and there's no pain. So while I'm at it, I'm just going to go ahead and do the McMurray sign, which is checking for, so the obturator sign is negative. That means that you don't have appendicitis. And then I'm going to check for the McMurray sign, which is checking for meniscus. Okay, so I'm going to do the same thing, rotate internally, but I'm going to lift it gradually down and straight. And I'm going to do the same thing, rotate it externally and lift it gradually down, and there's no pain, so your meniscus is intact. Now I'm going to I'm going to do a neuro exam. While we are laying down, I'm going to have you lift your leg up and slide your knee down your shin to your foot. Like, put your foot on your knee and slide it down in a straight line. Okay, repeat the same thing on the other side. Yeah, do it over and over. Okay, so that is a point-to-point movement, which is intact. While you're still laying down, I'm gonna go ahead and have you. Okay, no. Okay, let's stand up. Let's do some other movement. Okay, I'm gonna have you do another point-to-point movement. Do touch your nose and touch my finger. Touch your nose and touch my finger. No, with one finger. Nose, finger. Do it again. Okay, good. And I'm gonna have you do rapid alternating movements. You know, sweep your hands like this. No, do this. Okay, good. Now I'm gonna check the, come and stand here. I'm gonna check the rhombic sign. While here, I'm gonna have you close your eyes. Open up, open your arms for me. No, put your arms out straight and let them face forward. Okay, I'll be standing right here to hold you if you lose your balance, okay? Now, okay, that's okay, you can stop. So, the rhombic sign was negative. I'm gonna have you open your eyes. Do a slight knee bend for me. Okay, that's good. Now, I will have you, I'll check for your gait. After you just walk normally over there for me. Okay, good. Now, while you're there, stand there. Come back, stand, turn around. Come back to me, heels to foot on a straight line. Okay, thank you. Now, go. Now, I want you to walk back there on your toes. Okay, come back to me on your heels. Okay, that's perfect. Now, while we are still doing the neuro test, I'm going to go ahead and check for I'm gonna go ahead and check for your alertness. So, can you tell me your date of birth?
August 5th, 2002.
What year? What is the date of today?
February 28th.
Okay. So, what event is going? No. Who is the president of America?
Biden.
Okay, good. So, you're alert and oriented to time. You know where you are right now?
Yes.
Where are you?
At the clinic.
Okay, so you're alert, awake, and oriented to time, place, and situation. Now I'm gonna check range of motion from your neck. So I'm gonna have you. First of all, I'm gonna observe. I'm just palpating your neck to make sure there's no lesion, swelling, or any signs of infection. Your shoulder joints for any inflammation, swelling, or masses. The elbows, I'm gonna look for any swelling. The wrist, no swelling, no masses. I'm looking at your hips. I don't see no abnormalities, no swellings. Your knees, no swelling, no masses, no tenderness. Ankles, no swelling, no masses. Now I'm gonna have you do range of motion for me. So rotate your neck from side to side, back and forth. Now go all around. Okay, now I'm gonna have you do bend your head with resistance. Push against my hand. Try to bend your head against my hand. Good. Now do it the same on this side. Okay, good. Now bend your head forward. Good. Bend your head back. So your neck has full range of motion with 5-on-5 strength. Now I'm going to do the same thing for your shoulder. I'm going to have push down on your shoulder and have you try to push against me. Okay, so your shoulder strength is 5-on-5. I'm going to check the range of motion on your shoulder. Now I'm going to have you rotate your arms around for me. Okay, bring your hands close and open them all the way. Now I'm going to have you raise your hand against my pressure. Now raise, push your hand down. Okay, so the strength is 5-on-5, and that is also cranial nerve 11. I'm going to check the range of motion on your spine. So first of all, I'll look at your spine for alignment. So your spine is symmetric, there's no deviations, scoliosis or anything. And now I'm gonna check for range of motion. I'm gonna have you bend forward for me. Okay, bend backward. Okay, good. Now bend goes from side to side. Now I'm gonna have you bend back against my resistance. Okay, good. Bend forward against my resistance. All right. Yeah, so your spine has full range of motion too. Now I'm gonna have you lay down so I can check the range of motion on your hips. So just like keep your leg up and down for me. Okay, now try to resist. Pull your leg up, push it down against my hand. Good. Now push my hand, raise your hip up against my hand when I push your hand. Okay, good. Now we're not going to repeat on the other side for the sake of the exam. That is your hips have full range of motion with 5 on 5 strength. Now on your knee joint, I'm going to have you raise your knee up. Now raise your knee like back and forth. Okay, good. Now try to bring your knee up against my resistance. Push down against my hand. Okay, that's good knee strength. I'm gonna have you do abduction and adduction of your hip. Now just put your foot straight and bring your leg out and in. Now bring it in like across a little bit. Okay, good. So that's the range of motion on the hip. Now I'm gonna have you like push against my hand on your ankles. Now pull my hand. Okay, good. Now rotate your ankle all around for me. Okay. Okay, so your ankle has full range of motion. Now I'm gonna have you bring your elbows in and out, open in and out. Now push against my hands. Try to bend your elbows against my resistance. Okay, good. So that is also full range of motion on your elbow. Now I'm gonna have you rotate your wrist for me, round around. Now push against my hands, pull against my hands. Now squeeze my hands. Okay, that's good. So there's full strength and full range of motion on your wrist and on your hands. Now I'm going to do the anterior. Now while you're laying down, let's do the anterior drawer sign. So anterior drawer sign, what I'm going to do, I'm going to have you raise your leg up like that, and I'm going to sit on your elbow. Is it okay for me to sit on your foot? Mm-hmm. Okay, so if I can sit the video, I'm going to sit on your foot like this, and then I'm going to pull your foot up to check for checking for torn ACL. Yeah, so let's pull. So no clicking, no pain. So that means that your ACL is intact. Now I'm going to do the stand up. Let's do the upper scratch. So I'm gonna have you put your arm like this and bring the other arm, touch it. Okay, do it flip it and do it on the other side too. Okay, so that's the upper scratch test. That's to check for a full range of motion on your shoulder. That's perfect. Now I'm gonna do the drop arm test. The drop arm test is to check for any torn on your shoulder. So I'm gonna hold your arm up, and I would let go of your arm. Just relax your arm and try to hold your arm in place without letting it fall. Okay. Okay. So your your torn rotator cuff. That's what this thing is testing. So your torn rotator is you don't have a torn rotator. Your rotator cuff is intact. Now I'm going to do the you can sit down. I'll do the Tinel's test. I'll do the Tinel's test. Test is checking for carpal tunnel. Okay, So with this one, I'm gonna have you put your arm like this, and I'm just gonna no, put your arm on the thing, and I'm gonna touch just tap on your hand going up, and if you feel tingling and numbness on your thumb, forefinger, middle finger, and half of your ring finger, then that means it's positive. Okay. Any tingling? No. Okay. So another test for carpal tunnel is the phalanx test. I'm gonna have you stand up for that one. Put your hands like this, and then raise them up to your chest like this. And you should feel tingling and numbness on those same fingers. Do you feel anything like that?
No.
Okay, that's perfect. Now sit down. I'm gonna do your deep tendon reflexes. I'm gonna have to use this chair for that one. So can you sit on this chair for me? So I'm just gonna have you relax your arm, really relax your arm all the way. And I'm checking for your, this is the tricep reflex, okay? Is your arm really relaxed?
Mm-hmm.
Okay, so that's the reflex right there. And then I'm gonna do the bicep reflex right here. Just leave your arm relaxed, really relax your arm. Okay, that's you saw your arm move. That's the bicep reflex. I'm gonna do the brachioradialis reflex right here, and we should see your thumb move when I do this one. Okay, right there, that's the brachioradialis reflex. And then I'm gonna do the patellar reflex. Let your knees just relax. Just let your knees just fall. This is the patellar reflex right here. Okay, you saw your foot move. And then I'm gonna do the Achilles reflex right here. Okay, that move. And then finally the plantar reflex, which is, okay, see your feet coil to the downwards. That's the plantar reflex. Okay, we're not going to do it on both sides for the purpose of the video. And then now I'm going to check for sensation. I'm going to have you close your eyes, and before you close your eyes, so I'm going to touch you with a sharp and a dull object, and you tell me if you're feeling dull or sharp. Okay, so dull feels like this, and sharp is going to feel like this. So you tell me which one you're feeling. Okay.
Okay.
So
dull, sharp, sharp, sharp.
Okay. This side.
Sharp, 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 dull.
Okay, and on the lower extremities.
Sharp, dull.
And we're not going to repeat it on both sides for the sake of the video. And then I'm gonna put a vibrating object on your bony prominence, and you tell me if you can feel a vibration. Okay.
Yes, I can feel it.
Okay. Bring the other hand.
Yes, I can feel it.
Okay. Bring your foot.
Yes, I can feel it. Yeah, I can feel it.
Okay, so that's that. And then I'm going to okay. I think that completes the assessment. That completes the physical assessment. Thank you very much for your cooperation.
Thank you.